Hi, my name is Laura, and this is my memory speech. Last year, I was in a clinical rotations class at my high school. This is a class that teaches young students about the healthcare field by exposing teenagers to different hospitals and doctor's offices. One of the most rewarding experiences was when I had a rotation in the operating room. I spent 1 week at a heart hospital observing heart surgeries. One surgery especially stands out in my mind as being particularly informative, not so much because of the actual medicine involved, but because of how the team members interacted with each other. Wouldn't you think that a surgeon would value the golden rule of healthcare, that the patient's quality of care always comes first? After struggling through 4 years at a university, 4 years of medical school, 5 years as a surgical resident, and surplus years of specialization, I would expect surgeons to have confidence, and maybe even some arrogance. 13 plus years of schooling promises some bragging rights. However, no amount of schooling should allow one person to belittle another for being of lesser value. I knew I was lucky to even be allowed in the operating room, and I knew my job was to stand out of everyone else's way. Making it past 10th grade doesn't exactly hold the same respect as does completing medical school. I still remember my fingers trembling as I put on that face mask, although it did feel pretty cool to look like a real doctor, which shook some of my nerves away. Nurse Caroline, the woman in charge of babysitting me, pulled me into OR 2, where the sedated 19-year-old patient was waiting to have an aortic valve replacement. I was mesmerized by the scenery. All the team members seemed to be moving so fast, yet they all knew exactly what they were doing. There was a secret understanding which everyone seemed to be tuned into. I saw the anesthesiologist prepping the patient. The nurse was taking all the tools out of the containers and placing them on the table. When all tools and equipment were in place, Dr. Everest, who was the head surgeon, strode through the door. The doctor brought an aura of supremacy with him. He was in charge, and everyone knew it. Numerous questions were flying through my head about what this tool was or what this person was supposed to do. The team members looked pretty busy, so I decided not to break their concentration. That's when I heard Dr. Everest yell, "Where are my gloves?" He was overly dramatic as he barked at Nurse Caroline. I was appalled at his impatience. Nurse Caroline had explained earlier that surgeons always want what they want in an exact spot 5 minutes ago. After this incident, I understood. That little scene set the tone for the entire 3-hour surgery. I had picked a corner and not moved an inch for fear of being yelled at as well. The surgeon would bark commands and the team would comply. This was not an ideal environment for anyone. No one was learning or growing in this setting. Dr. Everest limited communication with his team, which could have caused life-threatening complications for his patient. His arrogance and hostility had taken over his value for the patient's care and produced an unsafe environment with inefficient teamwork. When I'm finished with those strenuous years in school and finally become a practicing physician, I'll remember that feeling I had when I was in my first OR. I never want to take any teaching moments away from the next generation, nor do I wish to forget that the patient's quality of care always comes first.